As children head back to school, 10 on your side is looking at vaccination trends. Since the beginning of the pandemic, the CDC reports the number of kindergartners up to date on their immunizations in the U.S. has ticked down. Even before the pandemic, the World Health Organization warned vaccine hesitancy was one of the top 10 global health threats.
It's important in general to reduce absenteeism, but then also for families, especially families with infants.
Virginia law requires all children entering daycare, kindergarten, 7th and 12th grades show proof of vaccination. If your child doesn't have the shots, they may get sent home.
Some of the vaccines that are required include measles, mumps, and rubella, as well as pertussis, hepatitis A. So all of these things try to prevent outbreaks.
Dr. Billy Blair Taylor says in recent years we have seen outbreaks of measles and pertussis, or whooping cough, in the U.S. Both are highly contagious and can lead to severe complications, even death.
Whooping cough particularly is a population that's very vulnerable are young infants. So that's why we try to create herd immunity in those that are around the infants, the family members, those who are caring for infants.
Virginia requires a minimum of 11 vaccinations. You may opt out of the HPV shot recommended for rising 7th graders, but doctors recommend it. It protects against 6 kinds of cancer, including cervical cancer for women. If you're not sure whether your child is up to date on vaccines, check with their pediatrician. You can get the shots at your doctor's office, local health department, or at some pharmacies that offer vaccinations. Now, vaccination rates are coming back up in Virginia post-pandemic. The Virginia Department of Health tracks immunization rates by school. To see what percentage of students have received their required shots in your school, click the link with this story on wavy.com. Now, the digital desk has more on back-to-school health. A CHKD pediatrician answered parents' top questions. Hear advice on nutrition, sleep, mental health, and more. You can watch the full conversation on wavy.com.